Attachment therapy is confusing in the sense that so many names are used for it. Holding therapy is another name, and I first learned about it when it came under the name of rebirthing. I don't see any reason why this treatment should work, but maybe that is not so important. What really is important is to ask the question, is there any evidence that it works? And to the best of my knowledge, there's not a shred of good evidence that it does help children in any condition. So one might say, okay, it doesn't work, but maybe that's not so bad. I think it's bad nevertheless, because the treatment is, in my view, not safe. There have been reports of very severe adverse effects, including, as far as I know, one death. The treatment is extremely abusive to the children. It just frightens them. It can even break them mentally as human beings. And the treatment is very expensive. And in this country, it seems that the taxpayers' money is used for this sort of treatment, which doesn't make sense to me in the slightest. I actually find it rather scandalous that something is being used which is firstly not effective, secondly not safe, and thirdly expensive. I think the man in the street has no notion of this happening. If people knew that this was happening, that money was being wasted, that children were being put in danger, I think there would be quite an outrage, and rightly so. I think all these treatments are regulated by organizations such as Ofsted, and it is up to these organizations to make sure that nothing untoward is happening. As far as I know, such control has so far failed to identify what is going on in this respect. If we want to help children who have health or behavioral problems, we first need to identify the exact problem. Then we need to look what actually might help for such a problem. And depending on what condition we are actually talking about, I'm sure there are all sorts of treatments which are effective, possibly less costly, and certainly less dangerous. If we want to move forward with treatments of that nature, one important step would be to inform the public about what is going on. If the public knew that treatments, expensive treatments, are being used without any evidence for efficacy and safety, I think that would be the first step to stopping these treatments being applied to vulnerable children.